Thanks very much. I'm delighted to be able to open this conference this evening. And I was struck when Laurie was speaking in my own memory. When I came here in 1999, there was virtually no link with the Reading University and the local NHS trust. And I was thinking how far we've come in that time, and just what you were saying about the Charlie Waller Institute being one example. I'm also looked at the programme today, and in terms of looking at physical and mental health interface, again, how far we've come. There's still a long way to go. But the fact is that particularly nursing and medicine training has been, if you like, hierarchical, but also very much specialist-driven. So the ability to move between the body and the mind is an overdue one, and it's an area that we need to explore much more rigorously and further. Now, I'm not going to talk very long, because I'm sure that we've got plenty in the programme and we're already running late. Luke did ask me to put in that I'm High Sheriff of Berkshire, which is very confusing for me because that's a completely separate part of my life. But I just tell you a little to say that nowadays it's a role you have for a year, and nominally you're in charge of the judiciary and the military. But yes, you're supposed to raise posses when required. But what I'm doing for my theme for the year, which is relevant, is that I looked at the judiciary, the magistrates and judges, to see if I could improve their awareness of mental health training and learning disability, only to discover they had no such training. So we started this as a pilot in Reading, in Berkshire Healthcare Trust, who've been very supportive, and we will look eventually to evaluation. So I think that's a sort of valuable exchange between, again, the disciplines to do that. So without further ado, if you could just look at your programme.